Hi, everyone. I'm your host, Dr. Terry Haddad, Vice President of Community Initiatives at Community Services for Children. Welcome to the Parent Project Podcast. This work stems from our vision for an engaged community where every child thrives and every family succeeds. CSC has been serving families for over 50 years, and we know that parenting can be hard. We're inviting local doctors, teachers, counselors, social workers, and other experts to provide perspectives to help parents maneuver the sometimes challenging role of parenting. Hi, I am so excited to welcome Erin Barron back to our podcast program. Welcome, Erin.
Thank you for having me.
So glad to have you here again. To tell you a little bit about Erin, she's been a nurse for 20 years, working exclusively in inpatient, outpatient, specialty, and emergency pediatrics. She's been with the Health Bureau for the last 5 years, working as a clinical services manager in areas such as maternal child health, vaccines, and treatment of communicable diseases. So today, Erin's going to talk to us about cold and flu basics. So what do you have to tell us, Erin?
So most people think the cold and the flu can be the same thing, but there are a few differences in each one. There are a multitude of viruses that can cause cold symptoms, but there is only one flu virus. It's just dependent each year on which strand is the strongest and which strand causes the illness. So the symptoms can be very similar and so can confuse people, and they're not sure if they have the cold virus or if they have the flu. But there are some telltale ways to tell if you have the cold versus if you have the flu virus. So the first is generally the flu is a very rapid onset. With the cold, you might start with, I have a little bit of a sniffle. I have a little sore throat. But with the flu, you can feel fine, and then all of a sudden you feel awful. So it can be pretty quick hitting.
And is everybody at risk of the flu, even little kids?
Everybody is at risk with the flu, and our vulnerable populations like small children, like people that have chronic health issues, and the elderly are especially vulnerable to the flu. So it's very important that we take precautions to keep those of us from getting the flu and from transmitting it to other people.
And so talk about that. How does the flu spread?
So the flu spreads through little droplets that are coughed out or sneezed out and that contact another person and then enters them and gives them the flu. And then they become contagious as well.
Sounds like COVID, right? Very similar?
It is very similar to COVID. Generally, the prevention is also very similar to COVID. We would say, the number one thing anybody can do to prevent spread of any illness is wash your hands. If you don't have the ability to wash your hands, using a hand sanitizer is also helpful, but that's the number one way to prevent the spread of any illness. The other things that we say are, if you are sick, stay home. That hasn't changed. We want everybody to stay home if they're not feeling well, and that will prevent the spread. Also, cough etiquette, coughing into your elbow, and then washing hands or using hand sanitizer after will also prevent the flu. But the biggest way to prevent the flu and the biggest weapon we have against the flu is getting the flu shot every single year.
And where can people get the flu shot?
So a lot of primary care physicians have the flu shot. Also, our local health networks have flu shot clinics, and also pharmacies in the area, generally the commercial pharmacies. We have the flu shot available at the Allentown Health Bureau to anyone from anywhere, whether they are insured or not. And you can walk in and get the flu shot on a Friday from 1 to 3:30 without an appointment.
And how about children? Do children get flu shots?
Children do get flu shots. Under the age of 6 months, the flu shot is not recommended. So 6 months and over, you can start getting the flu shot. And when a child gets their first flu shot as an infant, they actually will get a series of 2, and then will go to yearly after that point.
And so you strongly recommend flu shot for everybody in the house.
We do recommend the flu shot for everybody in the house. It's the best way to stay healthy and to prevent the spread. Children are in school and are around other children at all times and can bring it home to family members, vulnerable family members. So it's very important to get the flu shot. Generally, we started giving the flu shot in September. It's never too late to get the flu shot, even if it's December and you think it's too late, it's not. Get the flu shot as soon as you are able to.
What about colds? What should parents know about colds and children?
So the common cold is going to be everywhere during the winter time. It's prevented the same way with hand washing and with, cough etiquette and staying home when you're sick. The thing about a cold is it has less likelihood of causing serious problems. The flu complications can be things like pneumonia, bacterial infections, and hospitalizations. So colds are generally not associated with those type of complications, and they're usually self-limiting. Colds can be annoying, and the symptoms can be bothersome, but generally they don't have the same complications as the flu has.
Isn't there some type of saying like feed a fever, starve a cold? Is that true?
I don't know. I've heard that. I'm not sure if that's true. What we generally recommend for folks with cold symptoms is lots of symptomatic care. So fluids are helpful. Humidifier is helpful. If you have like a tickle in your throat, like warmed fluids can be helpful. Even for a child, you could do something like warmed, not hot, but warmed like apple juice can be helpful. But generally, there can be fevers with both colds and flu. They're a little bit more rare with a cold, but symptomatic care and trying to get that congestion moving through your system is usually the best way to help that go away. With the flu, generally we would say if you're not getting better, certainly if you have any difficulty breathing, if we have fevers that aren't responding, you're not able to keep fluids in, feeling very sick or weak, you should definitely see your provider and make sure that you haven't developed one of those complications associated with the flu.
And how long is a person contagious with either one of those things? Like how long can they spread it?
So we usually say that somebody is contagious until they are fever-free for 24 hours without the help of a Tylenol or Motrin product. So if you're giving your child Tylenol because they have a fever in the morning and they don't have a fever once you have Tylenol in them and send them to school, they are still contagious. If you're not giving them one of those products, symptoms are improving, fever is gone for 24 hours, then it's safe to send them back to school. For practical purposes, you can't keep every child with a sniffle out generally. That's very difficult during this time of year, but every parent knows their child very well, knows how they're acting, if they're taking those fluids in, monitors their fever. So it's important to keep an eye on how your child is.
Thank you for those explanations and tips and prevention. Anything else that parents should know?
I would just remind them again to get their flu shots and wash those hands.
All right, Erin, thanks a million. We hope you come back again sometime soon.
Thank you so much.
And have a healthy cold and flu season. Thank you so much for joining us, and thank you for listening. To learn more about the Parenting Project podcast, Project Child, or Community Services for Children, please visit cscinc.org.